Welcome to Translational Conversations from Model to Medicine, a series of discussions between animal and clinical researchers on the important interplay of their approaches for making advances in biomedical research. My name is Dr. Rachel Perleski. I'm a neuroscientist and the 2025-2026 ACMP/AMP Brad Fellow. As your host for this series, I aim to highlight conversations on how both animal and human studies are essential to understanding the origins of illness and the development of novel, impactful, effective treatments, while we also explore how researchers from both sides can collaborate and support one another. Today, we are very excited to welcome Dr. Zoe Donaldson, the Larry Gold Professor in the Department of Molecular, Cellular, and Developmental Biology and the Department of Psychology and Neuroscience at the University of Colorado Boulder, and Dr. Katherine Shear, the Marion E. Kenworthy Professor of Psychiatry at Columbia University and the founding director of the Center for Prolonged Grief at Columbia School of Social Work. Dr. Donaldson is a preclinical researcher investigating the neurobiology of pair bonding, love, and loss in prairie voles. And Dr. Shear is a clinical researcher studying clinically useful approaches to assessment and treatments of prolonged grief. Thank you both for joining me for this conversation today. I'd like to start by hearing each of you describe your research, especially what your major goals and objectives are. Kathy, why don't we begin by hearing from you? How would you describe your research in sort of layman's terms, and what are the major questions and objectives of the research that you do?
So my research, as you said, these days it focuses on assessment and treatment of people who have prolonged grief, people who are struggling with grief after a really, really difficult loss. And my work has been going on for quite a while. And so what I've basically worked to develop a psychotherapy intervention. I believe that I believe in psychotherapies because I think they're more fine-tuned than most, at least today, most biological interventions are, which I think is of interest in this discussion today. But I'm at this point interested in fine-tuning the efficacious treatment we developed, short-term integrated psychotherapy treatment that we developed back in the end, around 2000, in the 1990s, really, and trying to help clinicians understand what this treatment is about, to be able to use it in the most efficacious way, and to find the best way to disseminate this kind of information in a public health way. So I'm sort of all the way on the other end of the spectrum, you might say, from basic research.
That's great. Thank you. Zoe, how would you describe your major research goals and the research that you're doing right now?
So I'm on the other end of the spectrum from Kathy. So I'm very much a preclinical neuroscientist. I run a laboratory at the University of Colorado Boulder where we focus our studies on an unusual rodent model called the prairie vole. So prairie voles actually come from the prairie states of North America, and they're quite unusual amongst mammals because they share one really important behavioral attribute with us as humans, and that's the ability to form pair bonds in adulthood. So these guys, like us, tend to find a partner, settle down, have offspring, defend a territory together, and raise multiple rounds of offspring between the two parents. And so I fell in love with this species because I wanted to be able to answer questions like, how do you build a monogamous brain? How do you build a brain that's capable of falling in love in adulthood? Because the ability to fall in love with your offspring or with your parents is a sort of universal mammalian phenomenon. And the other thing we know is when these animals when we as humans fall in love, our behavior changes pretty dramatically. So when I talk to undergraduates, I sort of talk about how we go from maybe looking for a partner to doing a lot of Netflix and chill. And prairie voles do the same thing. And so the second major question that we tackle is, what are the changes that are occurring in the brain that lead to these changes in behavior that ultimately maintain and cement these relationships over time? And so that was really the focus of my research before I met Kathy. And because of Kathy, I now have another arm to my research that I think is very rich and very much still in its infancy, despite working in this area for over a decade now. And that's basically, if you can form a bond, you can also lose a bond. And so it turns out that prairie voles like us display distress, both behavioral distress and physiological distress, if they're separated from their partner. And so we have used that as a model for trying to understand loss and potentially grief. So I think grief and love are terminology that we use a lot when we talk about humans. And so when we talk about animals, we talk about bonding, we talk about attachment, and we talk about loss. But we're always a little bit hesitant to invoke these very human relevant terms. And within that realm, I really focus on two things. So biologically, what happens when you experience loss, and how do you adapt to it so that you can meaningfully move on with life?
Oh, how interesting. I mean, the prairie vole is, I feel like, a more unique species within the preclinical research area. And so I'd really like to follow up on what you've alluded to a little bit already about what makes the prairie vole so special when studying this concept of grief and bonding and loss. And I wonder if you could speak a little bit more about, what it is about using an animal model that is special when asking these questions. What kind of experiments or what kind of research can you do in the prairie vole that's unique to this kind of approach to assessing this research question?
Yeah. So I tend to think of prairie voles as inhabiting this absolute sweet spot from a preclinical perspective. So on the one hand, we have this phenomenon that we can't study using your standard laboratory rodents, whether they're rats or mice, because rats and mice just simply don't form these types of bonds, and you can't study something that doesn't exist. And so they have this behavioral attribute that makes them very human-like in some ways, but they are still a rodent, which means that many of the tools that we've developed to be able to study neural systems and complex behaviors in other rodent species and really drill down on the molecular and cellular basis of these things are things that we can deploy in prairie voles. And so I see them as a complement to what we're doing in humans, where we're trying to understand what's happening, but we are never going to be able to get at that sort of cellular and molecular level of biology.
Yeah, and just one quick follow-up. When I was doing a little bit of research, I saw that you actually developed a transgenic prairie vole.
Yes.
Can you speak a little bit more about why that kind of approach is so beneficial to understanding the neurobiology or underlying biological mechanisms of these kinds of attachment bonds and disruptions?
If you think about love, if you think about the emotions we experience when we experience grief, these are innate. Like, nobody has to teach you to fall in love. You can't just sit there and go, well, I'm not going to grieve anymore, right? These are embedded in our biology. They are embedded in our brains, in our emotional states. And so this means that there has to be some underlying genetic basis to our ability to do these things.
That's fantastic. So on the preclinical end of things, there's a lot of great work, it looks like, or sounds like, going on the genetic level that really helps us understand, what are these biological features that lead to these very human emotional experiences that we have. And so switching back to the other end of the spectrum on the clinical side, Kathy, I would love to hear a little bit more about what it's like to study this in humans and what is unique about doing research on grief and loss within human beings. How do we ask, what kind of research questions do we ask? How do we approach this? And what is it that we're getting that's unique to this side of the research approach that we can't do in humans or in animals?
Keep in mind that what I do, which is what I'm mostly going to talk about, is a very sort of like far end of the research in humans spectrum, partly because it's more focused on personalizing what we do and less focused on generalizing. And most science is really based on generalizing. I mean, that's what Zoe's trying to do, is generalize. And both, I think, are really necessary to understand really human behavior, because one thing about love, everyone knows this, but there are no two love relationships that are the same, right? And love is one of the most preoccupying, as Zoe was saying, experiences, the most central and preoccupying experiences of our lives. But it isn't only one-to-one love. That's when when we're in love with someone, it affects not only our personal interactions, but also our social systems and kind of everything we do in life. So it's very complex. We bring to it everything that we've experienced up till then. So in the kind of research I do, we need to bring in all of that complexity and pull out the commonalities from the complexity. So that's where it's going to be really important to know what the generalities and the complex and the commonalities are, but also to not overstress them. I mostly do treatment development, psychotherapy treatment development work. That's what I would consider the thing that has most motivated my work, and that really requires that combination. That's part of why I love it, because you have to pull those two things together.
Yeah, I'm wondering if you could speak a little bit more about this treatment that you developed and what that process looked like when you were trying to come up with something that would be more effective at treating prolonged grief. How do you conceptualize a new therapy? And then how did you actually take that to the clinic and start a research study and testing whether this was a therapy that was going to work and really help patients?
I was working with some depression researchers and doing anxiety disorder, but collaborating with them. And they got interested in bereavement as a pathway into depression, because everyone thought that grief was a depression. It was a form of depression back then. And they were doing both medication and psychotherapy studies using IPT, interpersonal psychotherapy, for depression. And surprisingly, neither of them was helping grief symptoms. As they started to measure grief symptoms, that it wasn't helping them. So they started thinking about this, and actually Marty Horowitz, who's a researcher out in California, had been interested in grief as a form of stress disorder, and he had sort of proposed it for actually inclusion in 1992 or something, for as a diagnosis of complicated grief back then. But he was the one that really saw it as a stress disorder, and they read his work and they said, well, maybe this is more like PTSD, and that's when they got in touch with me. And I started out saying, okay, maybe this is as we got to know the patients, it did seem a lot like PTSD in the symptoms, in the way that people were responding to a specific event. So we started out doing a treatment that was essentially bringing prolonged exposure for PTSD into the grief world. And that required a little bit more interpersonal. We kind of integrated some interpersonal psychotherapy into that by bringing in a significant other into the treatment. And then two grief researchers, Maggie Strobe and Henk Schut from the Netherlands, in 1999 wrote a very influential paper about how people cope with loss. It's called the dual process model of coping, and it posits that you have to both accept the reality of the loss, and restore your own capacity, restore your own life, basically, is what they were saying. So you had to do loss and restoration, and so those were both two components of what had to happen in order to adapt to a loss, really, is how we reframed this. And that brought in another component of the treatment, which around that same time, Mary Frances O'Connor, I think she was a postdoc at the time, did an imaging study, published an imaging study showing that the reward center of the brain was somehow involved in grief. And so we, what I did was, and it was sort of serendipitous, was one of my colleagues told me I should talk to someone who did motivational interviewing work, because it seemed like, there's also a lot of ambivalence in grief, that people they want to stop grieving, but they don't want to stop grieving. And motivational interviewing also had this kind of component of, they called it personal goals work. So we added personal goals work into our model at that point, and also some of the MI strategies. And that was about where I was when I met Zoe. And so we had a treatment that had essentially, it was structured around loss and restoration, and we had specific themes within each of those. We basically have 6 themes. One of them is understanding and accepting grief, and they're sequential. So it's understanding and accepting grief, then it's being able to envision or imagine a promising future, and then it's strengthening relationships, and then it's being able to narrate a story of the loss, a story of the death of the person. That we only work with people who have lost someone to death, and then learning to live with reminders in the world, and lastly, in connecting with the person who died, feeling the connection, because we don't lose that connection, which brings us back to attachment, which I didn't mention, but I have a long-standing interest in attachment, and that was really at the root of all of it. It's why I got interested in working in this area. After I finished my psychiatry residency, I did a postdoc fellowship with someone named Myron Hofer, who was a pioneer in studying rodent attachment, and very similar to the kinds of work that was eventually done in prairie voles, and which Zoe has brought forward in such a remarkable way. So attachment also is obviously a reward system function. There's obviously reward system. So all of this, all the reward system made a lot of sense to me right from the beginning, because I knew that you had to find a way to get some positives back in your life after you lost someone close.
Absolutely. Well, thank you for sharing that. What an incredible story, and just an incredible amount of work that's gone into leading to the development of this new treatment. And this is a great transition into thinking about what translational research really looks like in the world between researchers and how it informs our work. And I think we'll shift back to Zoe, and I'd love to hear about how work like Kathy's done or other researchers in this space has helped inform your own work. Like, what does the translational research process look like for you when you're thinking about research questions you want to investigate in your prairie voles? How do we take what we learn in the clinic, what we learn through these treatment developments, and use that to develop new studies and new ideas in a model like the prairie voles?
Yeah. So very briefly, my history was basically, as a graduate student, I was working with prairie voles. I was trying to understand the genetic basis of pair bonding. And then I did my postdoctoral work at Columbia, which is where I met Kathy Shear. And I was still working in psychiatric genetics, but I had moved into mouse models and a little bit of work in postmortem human tissue. And so Kathy actually had reached out to me. And so I think this is a beautiful origin story of sort of translating in two directions. Because we tend to have this bias to think, oh, well, translational research is what we take when we take it from an animal to the bedside. But in reality, in order to have effective preclinical research, it very much needs to be informed by what we know in humans, especially when we're talking about something like grief, which is hard to define, hard to conceptualize, and really one of those things that even personally, I think is you don't know what it is until you've experienced it. And so when I met Kathy, I was actually a bit dismissive at first. She said, have you ever thought about trying to study grief in prairie voles? And I was like, that sounds ridiculous, right? But then I thought about it a little more, and I was like, she's not actually proposing anything that is more complex than what we've already done in our attempt to understand love. We don't call it love when we put it in our research proposals. We focus on social bonding, sometimes call it attachment, right? But that's the same thing here. It's just that there's this human construct that has these underlying biological bases that we can instead call loss, for instance, rather than grief. And then we can really get a handle on it. So there were two things that were incredibly influential in my decision to start pursuing this. The first is that Kathy actually has two clinical, randomized clinical trials that she conducted. The first of which was comparing the treatment that she developed for prolonged grief disorder, this cognitive behavioral therapy, to cognitive behavioral therapies that are typically used for the treatment of depression, et cetera. And she showed that her treatment is more efficacious in alleviating some of the core symptomology of grieving, and in a prolonged context. And then the second one, and this is the one that really made me think a lot, is that she then did this in the context of including an antidepressant. So if we give people antidepressants, or we give them antidepressants plus this prolonged grief disorder therapy, Does that work better than without the antidepressants? And the answer very simply is that while the antidepressants can help with some of the sadness related symptoms, they don't alleviate the core sort of yearning phenotype that characterizes grief. And so there's no major added benefit to giving antidepressants when people are grieving for these core grief-related elements. And so for me, what that signaled is that biologically, there is something distinct about prolonged grief disorder that makes it different from PTSD, from depression, etc. And so that's the handle that I really needed to start thinking about this in an animal model, right? Like I still don't know how we begin to translate something like a cognitive behavioral therapy into an animal model. We can talk about enrichment, etc. But at the end of the day, I can translate something that has a biological basis, right? And so this observation that you can use a medicine in humans and it's not very efficacious for treatment of grief, but it is for the treatment of other disorders. That fundamentally means that there's something biologically different. And I became very interested in trying to track down what that could be. And then the second very influential sort of aspect of this, which Kathy has already brought up, is the focus on the reward system. So there had been some previous work, even in prairie voles, showing that it is distressing to lose a partner, right? Like they basically are more anxious. They change how they deal with stressful situations. They have elevated levels of stress hormones. But at the end of the day, you can elicit all of those same behavioral and sort of stress-related changes by just doing something traumatic to the animal. And so I don't think that gets at this core element of like, what is grief and why and how is it different from, say, depression or other negative mental states? And so I started thinking about, okay, when you lose someone, it's not about a general state. It's about the loss of this very specific, motivating, rewarding thing. And this is not limited to our human relationships, right? We can experience loss of jobs, loss of livelihood, all sorts of loss. But in all of those instances, it's really about losing one very specific thing. And that's when my discussions with Kathy around yearning really made me start thinking, we can measure yearning in humans. There are yearning scales. Can we measure something equivalent to yearning in prairie voles? And so one of the first things we did when I started my lab is we actually developed a task in which prairie voles had to work to get access to their partner. So we would call this an operant task. But basically, they have to press a lever if they want to go visit their partner. And then we can start manipulating that task and making them have to press the lever more times if they want to see their partner, making it harder. So they have to exhibit more effort. And so that was our very first foray into trying to come up with a way that we can measure the motivation to be with a particular individual and start trying to translate that into an understanding of what are the systems that are involved in yearning.
That's fantastic. I love this story of how you guys met and it like caused this sort of inspiration and shift in how you were thinking about your work. I think that is a great example of like what the translational process can really look like and how it can influence the research questions that we ask. So Kathy, I'll ask you a similar question, and you kind of already alluded to this and mentioned you used to work in rodents and now you work in humans. But I'd love to hear a little bit more about how work like Zoe has done or other researchers in this area has influenced how you think about your research and how you think about grief in humans. Are there specific examples or interactions with Zoe or with others where it changed how you thought about or understood grief and loss and affected how you pursued those questions in your own research?
Zoe's work really did influence me. Zoe's work is the only work, I would say, preclinical work that really has influenced my work, in the sense that the year that I worked with her, I guess it was about a year, right, that we worked together. She really taught me a lot about the brain and the brain reward system and the ways to conceptualize, the effect of a loss on the brain reward system. And what that did was, I think, very important for the therapy, because, as I said, we built in some reward system stuff. Actually, what we built in was an intervention we call aspirational goals work, and we started that. I thought we should start that in the second session of a 16-session treatment, because I believe that in order to deal with loss, you need to have some motivation. But none of the therapists would do it. I mean, and the therapist wouldn't do it, and the the patients really would say, I can't possibly do that. They were grieving so intensely, and it felt like a betrayal or something. So I would sort of keep gently supervising them to sort of build it back in. That's the kind of the way that we do the treatment anyway. It doesn't have to be rigidly, it's not really a CBT treatment exactly, because it isn't as specified. But so what I learned from Zoe about the importance of the reward system and the centrality really of it, likely in the whole syndrome, made me much more determined to get that into the treatment early on. And that has turned out to be something really, really important. So starting around, it was always there, but starting around 2015 or so, a little bit after that, when we taught it, all of our teaching emphasized it, and we talked about ways to help the patients accept it, what different things we could do. We build in what we called simple rewarding activities for them to do. So those two, it really sort of shifted some of the way we did this treatment.
Yeah, this is so interesting. I think, prior to this conversation, I was very naive to sort of this area of research. And I feel like I'm learning so much about the importance of the reward system in these processes, which, as you've been discussing, totally makes a lot of sense, right? What's specific about this grief and loss experience is the attachment to this individual and how they manifest in your life and how they motivate you or reward, you with that experience. And to go back to something you said earlier, Kathy, I really like this idea of acknowledging that the attachment is still there, even with the loss, and being able to still honor that in ways is a very important part of the healing process, which I think is very powerful to think about in this way. So, and I think this is a great transition point into sort of my next question, as you guys have worked together some and maybe want to work together more, thinking about how do we build good collaborations, good communication between animal, preclinical, and clinical researchers as you think about, what's worked for you and what you would like or think could be better. How can we build successful collaborations? How can we build and work towards a more effective translational process?
There's a couple of fundamentals that I think are absolutely essential. So one is it takes time to sort of learn the ins and outs of another discipline. Even if you're not working in the discipline, sometimes we use terminology that can mean totally different things in two different fields. And so, when I talk about dyads, I talk about two animals interacting with each other, but dyads can mean different things in other fields, or even a word like transcription, which means basically making mRNA to me. But a doctor might be, I just transcribe my notes, right? Yeah. So number one is you got to figure out where your language barriers exist so that you can actually have a conversation with each other. And that takes time. And the other part, I think one of the things that made it really much easier for Kathy and I to talk to each other is that she did that postdoctoral fellowship working with animal models, because all research is inherently incredibly complex, and it works within systems, administrative systems, regulatory systems. When we write grants, our grants don't look the same. And if you have absolutely no understanding of how these systems work, the fact that I have to write a protocol and propose experiments, and they are rigid and they are, whatnot. I can't just walk down the hall and do an experiment with my animals. That there needs to be some understanding of what the constraints are and how to proceed with the research. There are an equal number of constraints, if not more, when working with humans, right? So there's a language that has to be learned between two individuals. And then there also has to be sort of a shared and mutual understanding of what is and is not possible when doing work with humans, when doing work with animal models. And then I would say the third part is kind of the hardest part, which is chemistry. So I love talking to Kathy because every time that I talk to her, I am fascinated. I walk away feeling like I just learned so much. And so, that drive and desire to interact with her and learn more about her experience has been incredibly influential, but also motivating in terms of keeping the line of communication open and continuing to think with a potential translational perspective. And, I don't know how you create chemistry, right? Like, actually, I will just segue for one moment to say that there's actually research on this in humans, right? So there's the whole, every 10 years or so, it gets resurrected, this study about how to make two people fall in love. So maybe there's something there. But I'm also speculating mildly right now. Kathy has been incredibly patient with me as well, which is probably it's part of that barrier crossing, etc. But where I would just write something and she'd be like, "Ooh, no, that's not right." Instead of being like, "Why are you so stupid?" She was like, "Well, what if we think about it this way?" Those are some keys, at least in terms of our specific relationship and its success.
So the language issue that you described, Zoe, is exactly one that is really, really important. But also, even the language translation, the word translation, it means, to most people, it means, Greek to Latin or something, but, or it means, to most scientists, it means something related to genetics. And then there's research translation, which also, has a lot of different meanings. It's bench to bedside, it's bedside to social community, and we're not always using even the word translation in the same way. So I think, though, that the kind of translation we're talking about here is translating understanding of an animal model into a human, not only human understanding broadly, but a specific human condition that we want to inform an intervention for. And so that has a lot of steps in it. So that actually, because it is so really, again, complex, I think that that's where I'm going to talk about what I think is needed for this kind of translation. And also, one other thing about that is it's not only translation from the laboratory to the clinic, but also from the clinic to the laboratory, so that we, it has to do with how we ask and answer questions. And that needs to be an ongoing, intense process. It's sort of like when, what Zoe just said at the end, when sometimes she would write something and it didn't fit. And I know that it went the other way around too. I mean, sometimes I said things and she said, "Nah, that won't work." That won't work to do it, and that won't work to understand it either. So that kind of dialogue, what I think, if we really are serious about wanting this kind of translation to happen, I think we need to rethink how we create our labs and maybe even how we create our educational system, because we really need we need to be together a lot more. A laboratory should include, in my opinion, at least, a small clinical team, a small or a large clinical team, and a large research team, whatever it is. But we need to be together, and we need to be constantly talking to each other, not, sort of randomly if we can get a chance. And that's not because we don't want to. It's because we're very busy, and the pressures that we get for who to meet with and who to interact with are not each other, basically. So that's what I think is really, really important to think about moving forward.
Absolutely. I really love both of your sort of different perspectives on this. And I love what you said about bringing up what translation means, because it does mean so many different things to different people in different contexts. And I think as scientists, we're often like using the same words and not speaking the same language, as you guys have both alluded to. And I do think the more people we all have in the same room talking about these things, probably the closer we're going to get to a translational research process that captures what is uniquely human and what is uniquely animal, and allows us to think between both of those things in a way that moves the overall ideas forward. So just a couple more questions for you guys before we wrap up. I think the next thing I'd like to shift gears slightly and think a little bit more about is, how can we better support one another as science? It's, no surprise to anybody on this call that it's a little bit precarious in the scientific funding realm right now. And I think we're all a little bit apprehensive about, what we can do to speak up and be better supporters of science and better supporters of animal research. And so I'd love to hear from you both. We can start with Zoe as the resident animal researcher about what we as scientists can do to be better supporters and better advocates for good science, and especially animal science.
Well, I think every animal researcher wants to advocate for animal science. Our livelihoods depend on it, but even more so, we don't do this coming from a position of blasé, right? We're coming at this with a true passion to want to not only understand things, but also to do it in a way that cares for and appreciates the lives of the animals that we use. So I do everything I do because I'm trying to improve the human condition. And I think if you ask people who are grieving, especially those who are having a hard time with their grief, experiencing grief months to years later after the loss, they want something to help alleviate their pain. And I think a first step towards that, beyond the cognitive therapies that exist, are going to be trying to understand how we can intervene from a biological perspective. Kathy likes to say that there's no one size that fits all when it comes to grief, and that is absolutely true. So what are some new and innovative ways that we can approach this question? So what can people do on the clinical side? Well, most people wind up going to their doctor for things, right? And so that's where, if you're at the doctor, it's really important that your doctor says something like, well, the research on this says, and we wouldn't be there without animal research.
Absolutely.
Because this is most people's only interaction in a clinical setting. And the other is to just ideally be strongly supported by clinical colleagues. There is a big push, and I think it's a valid one, to try to move away from invasive animal research to the extent that it's possible. And there are new opportunities with AI. There are new opportunities with organoids, but we can't put everything into those two bandwagons at this time. Organoids are not animals. They do not exhibit behavior. AI can only sort of go as far as we can train it. And so there is a lot to be sort of valued and learned there. But I still don't think we're going to understand grief from an AI.
Yeah.
Maybe we'll get to a point where it can teach us something really, really innovative, but we're not there yet. And so, just recognition that we still need this type of research. It is still fundamental for discovery and important for improving human health is a message that I would love if our clinical colleagues are just relaying at every opportunity that they have.
Yeah, I love that. I think that's a very astute observation that most people are only learning about this stuff from their doctor, right? And it's not common for a doctor to be like, by the way, this came from an animal research model. Did you know? And I think some better communication and transparency on the process would do us all a lot of good and moving the public understanding forward. Kathy, any other additional thoughts? What's your perspective on how clinicians and scientists and others can better be supportive and advocate for these models?
We need to invite each other into our spaces more often. So we need to, clinicians need to be inviting animal researchers to give grand rounds, to do presentations, to do podcasts, to create podcasts, to do, but to talk to each other. We really need to talk, to bring each other into the space, because that is what's going to help other people who are watching or participating learn. And also I really think it would be amazing to create at least 1 or 2 labs in the country that actually, if they weren't actually integrated, which I think they should be and could be, but at least next to each other. A lot of times it helps to have your lab physically right next to another lab. You end up collaborating a lot. So
Absolutely.
That would be something like that. So you should look for space. We should look for space next to animal labs, have clinics next to animal labs, and animal labs next to clinics.
I'm always amazed how much sort of structural barriers create these things. So just the fact that, our scientific training is largely divorced from medical training.
Yeah.
Once you get to the more higher and specialized levels. Even I'm in a department of psychology here at the University of Colorado, and it is organized into 5 divisions, one of which is behavioral neuroscience, and that's where all of the animal researchers are housed. Even having divisions within a department, because of what the implications are. We each have our own graduate programs, et cetera, ultimately creates these barriers to interaction even within a department. And so I do think there needs to just be a consideration of sort of structural factors. How do we create the infrastructure that really allows, human clinicians, human researchers, preclinical researchers to be interacting on a regular basis, and not have it occur in a way that is potentially detrimental to careers, because there is often a cost to these things.
Yeah, it's very true. And I think that like in the field of neuroscience and psychiatry especially, it is a very interdisciplinary field. And yet we're not talking to each other as much as we really ought to be for a space that is so interdisciplinary and reliant on so many different ways of thinking about and approaching the same question. All right, we'll wrap up in just a couple minutes here. But before we do, I want to sort of open the floor for anything else you guys would like to add. If there's anything about your research or your approach that, you want to clarify, or any misconceptions you'd like to clear up for the public or anyone listening to understand, here's the space for any final thoughts you'd like to share. Kathy, why don't you start with anything else you'd like to add?
I want to say one thing, which is, at the heart of what we've been talking about through this whole podcast is the importance of attachment relationships. But the importance of attachment relationships in human human intervention research and in human thinking, in clinical thinking, is often attachment style. When people say attachment, they think about attachment style and its risk factor. It's a risk factor for the development of difficulties with grieving. That's true. But what we're talking about is something entirely different than that. It doesn't have anything to do really directly with attachment style. And I really wish people would understand that. That is one thing that people misunderstand also about the research that I do. That, and there's, psychologists are producing study after study and now meta-analysis after meta-analysis of the influence of attachment style on grief. And it's like, okay, it's important. It has a little bit of importance, but that's not where attachment is really important. And where it's really important is what Zoe's doing, is really understanding what is that bond about and what happens when it's broken. But even understanding what it's about, in my view, even if you don't document what happens when it's broken, when you understand what it's about, you know something more about what is likely to happen when it's broken.
Yeah,
and
absolutely.
So all of the work that's been done on understanding attachment bonds is really relevant to grief, actually.
Yeah, and I like kind of the meta nature of this conversation where we're also talking about how we as researchers need to develop stronger and better, attachment bonds to one another. Zoe, I'll give you the final space to share anything about your research or prairie vole research in general you would love to share or you'd like to address in our final moments.
I think one of the important things that we need to explicitly state here is that we both study grief, and grief is a natural response to loss. And it is an important part of the process of attachment loss. It is probably what keeps us in our relationships, right? The same mechanisms that drive us to seek out another individual and maintain these bonds, cement these bonds over time, they become these unrequited maintenance mechanisms that can't be fulfilled. But neither Kathy nor I are trying to erase grief.
Yeah.
Nor are we trying to treat grief per se. Instead, in 2022, Kathy alluded to this, there's a new diagnosis that was added to the Diagnostic and Statistics Manual for Psychiatry, and that is prolonged grief disorder. And this represents a subset of bereaved individuals that are really having a hard time adapting to loss and re-engaging with life. And so when we talk about treatments, et cetera, it's largely for that population of individuals. So I just wanted, just in case there's any misconceptions out there, we're not trying to erase grief. We want to understand it. And we want to understand it with the goal of alleviating pain.
Thank you so much for sharing that. I think that is very important to emphasize, and that there is a reason why we experience this, and we shouldn't try to eliminate it entirely. We just want to better understand it and treat those who are maybe struggling with it more than they should, and to be healthier. Well, thank you guys both again so much for joining me today to discuss your research and the translational process and how it's influenced your work. This has been such a great discussion, and I've really appreciated hearing both of your perspectives on how we use both preclinical and clinical models to understand bonding and attachment, loss, and grief. So thank you again to Dr. Shear and Dr. Donaldson for your time, openness, and your invaluable insights today. And of course, thank you to everyone who took the time to watch or listen today as we learned more about how these parallel research avenues take us from model to medicine. So be sure to tune into our future episodes as we consider these important translational conversations. And until next time, remember to stay curious, intentional, and thoughtful in all your pursuits, and especially in research. This Lab Rat Chat special series, Translational Conversations, is made possible through support from Biomedical Research Awareness Day, a program of Americans for Medical Progress, and the American College of Neuropsychopharmacology.